Hi, John.
Hey, Dr. Scott, how's it going?
Doing great, man. How are you doing?
Not too bad, not too bad. So we're gonna get straight into this. I heard a rumor that a party actually changed your life. Obviously, you told me that you have a degree in emergency medicine. So how is it that you came into the world of hormone replacement therapy?
That's a big story. I hope you have time for it. So basically what happened is this is a journey that I personally took. And I tell people this all the time. And, sometimes it feels like repetition because I say the same story over and over again, but it was pretty life changing for me. When I was in my 40s, kind of mid 40s, I had all of the symptoms of low T. And it's like all of a sudden my eyes opened one day and I realized that I just was not comfortable with myself. I literally had a gut. I had zero sex drive, no libido whatsoever. I had no motivation. I've always been like a total workaholic. I could outrun anybody in the hospital, outwork anyone. But, when I was at home, I had no desire for anything. I didn't like to watch television. I didn't want to go out. I almost felt like I'd lay around staring at the ceiling and thought something had to be wrong with me. So I checked several things. I was checking thyroid levels and testosterone levels and trying to diagnose myself, which is not always the best thing for a physician to do. But in doing so, like I said, I checked my testosterone level and it was within normal range, but it was on the lower end. Now, the way we are trained as traditional Western physicians is that we look at any lab value and we compare it to what's called the reference range. If it falls in the normal range, it's okay. It's all good. That's not the problem. And so that's what I was assuming at the time and believed that. Now, by chance, not long after that, I was at a party that I was invited to and had a couple of glasses of wine. I was introduced to this man who was a physician from Tennessee, and he was actually a gynecologist, but he had a background in endocrinology. So he was a fertility doctor. And it turned out that he was treating some of my friends' wives with hormones. They were actually flying to Tennessee to see him on a regular basis because there was no one in the New Orleans area that they felt comfortable with seeing. And there was no one really progressive at that time enough to be treating them the way they felt like they needed to be treated or he was treating. So I had a conversation with this gentleman. And in our conversation, somehow I started talking about my symptoms. And, that's not something I would typically do. Usually, like many men, I keep that to myself. I don't really want to talk about my problems or, even admit that I have problems. But in any case, I did. I opened up to him. And I think it was a bit because I knew that he treated these people with hormones. And I also knew about his background. And not long into our conversation, he just looked at me and he said, "You have low testosterone. You need testosterone. It will make all the difference for you." And I said, "No, I checked it. It was within normal range." And I will never forget, this man looked at me and he said, "You have to pay attention to your body. Listen to yourself, not the number." And that was amazing to me because I think that was the first time that the light came on and I was thinking, wow, maybe he's right. Maybe it's not about the number. Maybe everything I've been trained is not exactly correct. And so he did start treating me, started giving me supplemental testosterone. I started with injections. And I tell you, it was not long at all before I was seeing a whole new me. My sex drive came back very rapidly. My desire to get out and become more active. I started going to the gym. I hired a personal trainer. And man, within less than 6 months, I was in the best shape of my life. I put effort into it and I felt amazing. It all started coming back. And, I tell people all the time, that's when I began research. But to be honest, I didn't start studying about hormones for the sake of studying hormones. I started learning about hormones because back in those days, all of us believed that increasing testosterone would increase your risk of heart attack, stroke, and increase your risk of prostate cancer. And so my journey began because I was trying to figure out the risk benefit, right? I was feeling amazing. Things were coming back. But what was I going to give up? Am I going to have a heart attack down the road? Am I going to end up with prostate cancer? So that's where the journey began. And that's when I really began to study and delve into all of the research. So over the years, and that's been 11 years now, I have pretty much read every research paper out in the last decade. I have flown to lectures. I've read most of the books that I can find that I consider to be interesting. in about hormones and hormone replacement. And somewhere down the line, I just kind of started treating people, and that was not intended by any means. I just, like I said, was on the path of learning because I was concerned about my own well-being and my own health. Basically, what I have found during this time was that the myths or the concerns that we had back then about cardiovascular disease and prostate cancer have been proven wrong. There have been several studies that have come out that have shown that increasing testosterone levels does not increase your risk of cardiovascular disease or stroke, and it does not increase your risk of prostate cancer. And in fact, there have been quite a few studies that have shown that men with low testosterone actually have a higher risk of heart attack, stroke, and Alzheimer's disease.
Oh,
So
wow.
that was very important for me to learn all of this and to start believing that, wow, this is actually, it could be healthy. It's not bad for you. It can be healthy. And since that time, I felt incredible. I mean, I feel good. My body's in shape. I have more energy than I did back in those days. And I tell you what, man, I would never go back to where I was, to that place. Just couldn't do it.
Just wouldn't look back.
No, I won't look back.
I have so many questions about that. You said a lot of things which I feel like are so important. And basically, the first one is self advocacy, like listening to your body. That seemed to be one of the most important things that you mentioned because, as you say, people go to the physician and get told everything's normal all the time, right?
Yes, yes. That's huge, John. Actually, the thing that I hear often when I'm meeting with patients is that they have gone to their doctor and they've told their doctor they're having these problems. I have low libido. I just have low energy level. I'm gaining weight. I don't know what to do. Is something wrong with me? And over again, I hear patients telling me, my doctor just told me I'm getting old. You know what? That's true. This happens to us naturally in life. Our hormones decrease year by year. And when they do decrease over time, we're going to start having problems. Our body's not going to be able to build the muscle mass that it did before. We're going to start gaining fat tissue in our abdomen. Your sex drive is going to drop. Your mental clarity is also going to fade. That is very important with testosterone. Testosterone has such an important link to the brain. We're also finding things like anxiety and depression significantly worsen as we age and are correlated to lower testosterone levels. So when you go to your doctor and you have these problems and your doctor says you're just getting old, or they brush it off, or they do a whole battery of tests and they say, oh, I can't find anything wrong, then unfortunately, too many times men are just left not knowing where to turn. But honestly, you have to look out for yourself, like you're saying, and try and figure out what I can do or what may be the problem that's causing this. And it's more frequently than not, it is the decreasing hormones that becomes an issue that these men are talking about.
So, seeing that with the physician and hormone replacement, why do you feel like there's such a big gap between primary physicians not learning about this more often and being able to bring that up in that sort of environment at first contact?
The reason is because we don't learn about testosterone or hormones. In medical school, I've talked to a lot of my physician friends about this. We learn the basics. Medical school is like going to high school. You're going to learn the basics about the things that you need. And then if you're going to go into a career, that's where you really learn all of the interesting, the details about what you're going to do in your career and your life. So if you think about it, medical school gives us a basis of medicine. Then each of us decides what career path we're going to take. Are we going toward cardiology? Are we going toward endocrinology? Are we going toward, internal medicine? And so none of the specialties, none of them, not even gynecology, teaches detailed information about hormones except endocrinology. And endocrinologists do not really get into treating the day-to-day decreases in hormones in men and women, a specialty that nobody gets any direct information about after medical school. And there's no detail that comes out. So when you go see your primary care doctor, he or she doesn't really spend a lot of time learning about hormones in their residency. And then when they get out, that's not really a main part of what they do in their career. So they're not really paying attention to the studies that are coming out year by year. And I find that that's very common. A lot of my patients will tell me that, they come to see me and then they'll go back and see their primary care doctor and say, hey, I'm getting testosterone now. And I frequently hear from these patients, oh, my doctor says I'm going to have a heart attack. Well, that myth has been debunked many years ago. But why would you expect primary care doctors to know that? Because they're not really keeping up with the research in hormones, because that's not what they do. So they're remembering 10 years ago when they were in residency or in medical school and the myths that I was dealing with back in the day when I first started this. That's unfortunately what patients are seeing over and over again.
That's crazy that there's such a big gap in between that. I feel like it's something like that's really important. Going back to your original story, something else that really popped into my head was kind of the stigma around hormone replacement, like for men trying to figure out what's going on. So tell me a little bit about what is the most common thing that you find when patients are coming in that they're telling you their symptoms, or what is stopping them from talking about it? Because like you said, even you were finding it hard to come out to people and talk about your symptoms and
Mm.
everything like that.
Oh, yeah. I actually hid it for a long time. You know, my wife, you've met Shelly.
Mhm.
Shelly and I have been dating pretty much on and off for 17 years. And I think it was 15 years before we got married. So we were together quite a while. So she was around me during all of this time that I was starting to do testosterone. And I was actually hiding the needles and everything in the closet. I was hiding it away from her. She had no idea for years as I was doing this, and it was improving my life. And because I was myself ashamed of it, I didn't want her or anyone else to know that I'm needing or taking a testosterone supplement. So I see that all the time. That's very important with men, is that they don't want to admit that there is a problem. And it's not necessarily a problem. It is natural. Our hormones are going to naturally decrease as we get older. And yes, you are going to feel it and your body is going to show it. But do you want to do something about it? So that's kind of the stigma that I see, is that men just don't want to talk about something because they feel like for some reason it makes them feel inferior or less
Mhm.
than. When in fact, that's not at all true. We're all going to go through this. But one of the main reasons that men are coming in to see me, or at least talking to me, is they're talking about their sex life with their spouse, or how it's changed over the years and how the libido's dropped. And it's so funny because, I hear it all. I've talked to men and women about various details of their sexual life and their sexual experience through life. And it's, until they start feeling comfortable with me, many of them just inch into it and they don't even use the terms. They say, well, things aren't working like they used to. I'm like, okay, well, I understand what you mean. And, I love it when they do start feeling comfortable and opening up to me and telling me exactly what they're feeling and how we can work together to help that. But see, testosterone, it has this kind of stigma, and a lot of people believe that it's all about sex and the sex life. But it's so much more. And it's interesting to me that when I see these men and they do decide to take that step and start using testosterone or hormones, then I get the feedback from them. And so many times I hear, oh my God, or oh wow, I didn't expect this. They can think more clearly, they're more active, they just feel good. But one of the interesting things that has been found recently about testosterone, and how I mentioned earlier how testosterone is so important for the brain, it increases dopamine in the brain. And there are receptors all over the brain for testosterone. But there's a certain little area in the brain called the amygdala. And the amygdala is about the size of an almond, and it has more receptors for testosterone than any other part of the brain. So you can think of the amygdala like an amplifier for your feelings, for your libido, the sex drive, for that fight or flight, for that boldness that you feel, right? And so as we get older and the testosterone's decreasing, the amplification of the amygdala is turning down. So all of those things are decreasing. So when you bring up the testosterone, you start getting a lot of it back. That's where the sex drive comes back again. That's where you just feel like, I got this. I can take on the world. And that's why, again, the anxiety and depression improves so much, is because that comes from having that fear factor. Or, in my opinion, what I've seen from so many patients that have anxiety and depression, when you can make that person feel bold and feel good again, it just blocks the triggers that cause the anxiety and depression. So they just feel like they got it, just like, when we're teenagers and we're climbing up trees and don't have any fear of falling off. You don't feel like that when you're 50 anymore.
Hmm.
Nobody wants to climb up a tree at 50, 55, or 60.
Talking about like, how people are starting to feel better when they start doing all the service and things like that. So what can someone expect from like a time frame point of view? Like I'm assuming I've never done it before, but I'm assuming it's not just instant results. I'm assuming there's maybe time between it or like, what can someone expect?
Yeah, there's kind of a time frame. It's all very individual. Again, one of the reasons that a lot of people come to see me is because of their sexual health or sexual issues. Now, that's one of the first symptoms, if you will, that will improve. Generally, you will see an improvement of your sex drive within a week or two or less in some cases. It's very
Wow.
rapid. Yeah, it can come back quickly. You can also feel the improvement of your cognitive function very rapidly. Things like the boldness that you feel, those can come back very quickly. I mean, literally within weeks. Now, other things like muscle mass, that can take time. It took a long time to lose it. It can take a little time to get it back. But the more effort you put into it, the more you're going to get out of it. So, the one thing we talked about, the amygdala earlier and how it can kind of amplify the feelings. When I first started doing hormone replacement, as I was inching into it many years ago, I would tell people all the time that we're going to increase your testosterone and that will increase your sex drive. In fact, that is not true. It turns out that if you didn't have a sex drive or libido prior, it's not going to make one for you. That's what the whole amygdala is about. It will turn back up what you used to have. It'll crank up those emotions and the feelings. But if it wasn't there before, it's not going to create it. So it can help bring back what you had and who you were. Now, also, I tell people this as well, that it's so much easier to keep what you have than to gain what you've lost. So these people who are waiting for longer and longer periods, once you get into your late 50s, 60s, it'll help. Of course, it can be increasing your testosterone can be very beneficial, but it's not going to be as beneficial as it is for someone in their mid to late 40s who still have the muscle mass and the, libido, and they still have that to gain or to keep. And it just seems to work better than trying to pull back what you've lost.
With that being said, I guess, is there a time where a man might feel it's better to take control and to start everything? Or obviously you said that waiting too long can have its detrimental effects, but is there a time where it should be better to start?
Yeah, well, generally, I've had a rule of thumb that I would not see patients before age 40. That's not strict. There are some men in their late 30s that I've talked to and we discuss it, but I like to be a little cautious about it. I don't want to push people to believe that this is a miracle and they need to start it right away because there are always consequences. Now, I truly believe that testosterone, if optimized, can be healthy for you. And I don't see myself ever stopping it. As long as if I make it to the 90s, I'll be taking testosterone into my 90s. But you also have to consider a couple of things that are very important. And this is something I tell every man that sits in front of me. Number one, studies have shown that testosterone supplementation for a number of years can potentially decrease your sperm count and could potentially permanently decrease the sperm count in some men. That's something to think about because a man in their late 30s may still be considering having children at some point in life. And you don't want to start this unless you really understand that there could be that consequence. Also, I haven't been able to find any studies that look at testosterone levels prior to starting supplemental testosterone, and then if a man quits doing it after a period of time. Generally, I tell men that it is my belief that if you stay on supplemental testosterone for a number of years, that it will probably decrease your body's ability to produce testosterone at the same level it would have. So you have to consider that as well. So to me, this is a lifelong journey. Once you're ready and you really think it's going to make a difference in your life, then you have to consider that this is what I'm going to be doing for the rest of my life. Because if you start it and you stay on it for, say, 3 years, 4 years, and then you say, I just don't want to do this anymore, it's not a Band-Aid. Things don't all of a sudden get better and stay better. If anything, they could potentially get worse. But at the same time, I have had people that I've talked to that have told me after a conversation, they understand that they're going to potentially have to be on it forever. So they want to wait a little while and they want to keep waiting and putting it off because they know it's going to potentially be a permanent thing they have to do. But those same people that I talk to tell me they have virtually no libido. They don't have the endurance they did anymore. They don't feel like the same person. So I wonder what the heck they're waiting for. When you can have an improved quality of life, you just want to wait a little longer just because you want to make sure that, of what? I don't know. So I don't quite understand that reasoning either. If your quality of life is an issue and you feel like it could potentially be improved by testosterone supplementation, then why wouldn't you consider it and, want to improve that quality of life? But at the same time, you really need to understand what you're getting into. That is so important to me.
That is very important, especially when we're talking about timeframes of like, starting this and then, we have to consider what we are doing. So talking about positive results and negative results, how often do you see negative results, would you say, while doing your services?
I don't really see negative results. I've had one person that is actually a friend of mine that had a very low testosterone. And after treating him, he said he felt worse. He did not get not only improvement, but he felt fatigued. He just said he was worn out all the time. He didn't get any benefit from it. That's the only one out of the hundreds of
Yeah.
people that I've treated. Now, I have had some that have told me they just don't feel much. They're not getting, much benefit from it. I get that. And so if you're considering trying testosterone and you do get on supplemental testosterone for 6 months or so, I really don't think it's going to be a problem. You're not going to suppress your cells, your testes enough that they're not going to rebound back to normal. I wouldn't see that as an issue. What I'm saying is if you stay on it for years and you're suppressing your testes from producing testosterone, I think that could become an issue if you decide to stop at that point. But as far as negative, I don't see a lot of negativity. I don't see many men having any significant problems with it. But the only downside, I think, is that some men just don't get the wow factor that others do.
You had a really good quality of life change. So I would assume that a lot of people see this as quality of life change, but also some see it as maybe being more of aesthetics and or cosmetics. How would you come around that?
I get what you're saying with there are, I guess, a lot of people that are going to look at testosterone treatment and say, oh, that guy just wants to be beefed up or he just wants to have, a good looking body and I have actually had patients come see me that say, oh, I can't build the body I want. And those are not the patients that I really want to see. Those aren't the ones that are my prime patients. It's so much more than that. Like I was saying before, that testosterone can improve your cognitive ability. You think more clearly. It improves the way that you look at the world, the way that you can function in the world and feel, makes you feel more bold. And of course, there's the sexual health as well. So when we talk about quality of life issues, I mean, as men are getting older, they're becoming slowly more frail. They have less muscle mass. And I'm not talking about a ripped six pack. I mean, you just got to be able to be mobile. You have to be able to walk down the street and walk to the grocery store. And how long are you going to be able to do that as an older man? Well, I have 100% belief that if you start on testosterone supplement and optimize your hormones and at least try to be healthy, you will have that ability far longer than if you just let your body continue down the path of decreasing hormones, decreasing muscle mass, decreasing bone density. What is that going to lead to? I really think it's much healthier for you to stay at a more optimal level. And I think that the benefits will play out in the long run. So it's more to me than just looking good on the outside. It is actually feeling good on the inside and being healthy for a longer period of time.
What's next? Obviously you have a really big passion for this topic, considering what you went through in your life change. So what brought you to this format and trying to answer questions, and how are you going to keep this conversation going?
That's sometimes hard to do. I actually do I do a lunch and learn that I love doing. I've been doing it with women for a long time, and we draw a good number of women. We do it obviously separately for men and women. We tried to do it together with men and women. That didn't work so well because the questions are different. People don't talk about, their issues in front of the opposite sex as much. I also like doing these. I was on a recent podcast with a doctor and just enjoyed it. Just had such a great time talking to him and talking about these same subjects. I'd like to talk about it more and talk to people more. I love talking to patients. As a matter of fact, the main thing that people who work for me know that when I have a consultation with a patient, that consultation is going to be 45 minutes to an hour. And I charge minimal amount for that because I really want patients to understand what we're talking about. I hate the idea of somebody coming in and thinking that I'm going to slap a prescription in front of them and say, here, take some testosterone and pay me for the visit. I prefer saying, I'm going to take a small amount of money for this visit just to cover my expenses. And I really want you to learn about yourself and what's happening in your journey through life and give you some of the knowledge I know and the experiences I've had. I absolutely love that. It means so much to me.
Just to wrap it up, say I am the guy who's listened to this podcast and I am thinking, yes, that is me. What do I do next? What is the next steps that I should take?
Generally coming to us, you would make a call to our office and set up a consultation to speak to me. And then we sit down one-on-one and have that discussion about what's going on with you in your life, what you're dealing with, how you're feeling, what kind of quality may have subsided over the years. And then I can tell you my experience and what I've seen with other patients. This is a decision that I don't make for you. It's a decision you're going to have to make. I just love giving people information and helping guide them in that journey to figure out how they can improve themselves. And it's not right for everybody. I've had so many patients that come in and I talk to them and then we both decide, no, it's not time for you. It's not really what you need right now. So, and that's not a big deal at all. It's the point is trying to help people learn about their body and their life and what's happening to them as they experience life. And then, once we have that conversation, we'll check your blood levels and check your testosterone levels, hormone levels. And when those levels come back, we will talk again. And generally, I'm going to call the patient from that point. I'm not going to charge them to go over, their labs and talk to them about how they're feeling and what I'm seeing in the labs and then give them, my suggestion of what you can do from here. Now, if your testosterone is really low, if it's actually below the norm, I usually suggest that these men follow up with their primary care doctor because insurance should pay for their treatment because they really fall into that category of low testosterone. The majority of my patients do not. They have all the symptoms or at least many of the symptoms of low T. And usually when I talk to men who are sitting in front of me, it's because they have a problem. And we find that their testosterone levels are usually on the lower spectrum of normal, which is exactly where I was when I started this process. From that point, once we do start, if they do want to start the testosterone treatment, then I'll check their levels at about 6 weeks and then follow their red blood cell counts and their estrogen levels and PSA levels. It is so important to be safe about this and do it right. I've actually had a lot of patients who have come to me telling me that they have gotten testosterone from their trainers or their bodybuilders. And, they've been doing it the wrong way. And they're concerned because they're just injecting and they're not really making sure they're healthy with it. And they're treating themselves right. And that can be a problem because usually when you're taking testosterone in men, you frequently will see that the red blood cell count will increase. That can become dangerous. You also want to follow the estrogen levels. Far too often, these clinics around here in bodybuilders are using estrogen blockers to completely block estrogen. Men need estrogen. There have been studies that have shown that men who have low estrogen end up having erectile dysfunction or having lower libido because estrogen is directly tied to your sexual health as well, just like it is in women. So doing it right, following your hormones, your red blood cell count, your PSA, and balancing everything appropriately is the best way to do it. And that's what we do. We work with every person individually. Every single one of my patients has my cell phone number. When they have a problem, We talk it out. That's what I'm here for. I absolutely love doing this and love talking to people.
I love that. Very personal and definitely feels like no pressure situation when going into this. So that's amazing. I feel like a lot of pressure would be put on people, like, trying to book appointments, they're paying money and things like that. So that's awesome to hear that someone's out there just trying to help out everyone. So that's all we have. Thank you, Dr. Scott, for talking to us.
Thank you, John. I appreciate it. This was awesome.